Some argue that a public auction will be cheaper. Some argue that if a public auction goes head-to-head in competition with individual insurance products, it'll keep those individual insurance products more affordable. It'll increase competition. During the Roosevelt administration, when the Tennessee Valley Authority was created, one of the major arguments for creating the TVA is that you would create a benchmark for how much you would charge for electricity, and then that would set a standard for others to follow. There's been some debate about the effectiveness of that, but nonetheless, the public option comes up in the debate from a substantive perspective because it's seen as a tool of helping to promote competition and affordability, either as an alternative or as a benchmark. Now, the public option also comes into play because it is a political, and I get to use my analogy here, it is a political football. The life of the public option itself will be the subject of many a thesis, many a paper, many analysis, and I'm sure many books over the next years. Why? Because it seems to have come in and out of discussion at strategic times. It came up for discussion when the healthcare reform agenda was set in the spring, and then all of a sudden it kind of vanished. Senator Baucus didn't want anything to do with the public option. No, we don't need to go there. All of a sudden, the insurance companies didn't look like they were coming to the table, and so other folks started saying, we need the public option. Why? Because we need it as a bargaining chip to get people there. So the public option has ebbed and flowed. Right now, the public option is what? Is it back on the table? Affirmation times. You bet. Okay? Will it exit our attention? I don't know. Like a good sportscaster, I'm not going to predict the outcome of the game. I'm not that confident in myself. But the public option should be seen as both on a substantive level as trying to be a remedy or solution to the problem of the high cost of health insurance in the private market. But it also should be seen as a political device that has helped to influence debate and dialogue over time. Now, one of the major issues involved in this private insurance reform or individual market insurance reform also has a regulatory dimension. That is trying to eliminate exclusions and denial of insurance or setting insurance premiums very high because of pre-existing conditions. Okay?